When a woman admitted to a hospital for a pregnancy dies unexpectedly, it is quite natural for at least a few people to wonder if there might have been a mistake or wrong treatment. After all, pregnancy is part of normal life. Why should death happen? Unfortunately, rare but serious complications can sometimes occur in what appears to be even a routine pregnancy. Let us look at the experiences of a few senior gynecologists through the eyes of a junior doctor, Dr. Teresa.
Mother dies following childbirth, gynecologist suspect.
I too read this one.
After your studies, you think that you will get a safe and secure job. Then you realize that in small hospitals, you may not have an anesthetist 24/7 and not even a ready ambulance. Then you start thinking a big hospital is a better place since there's a team and round-the-clock facility. But now I wonder, where can a gynecologist can actually do our duties in a safe environment?
Yes, sir. Thomas, sir, tell me.
This is regarding a patient, Tina Jacob, who was referred to your hospital yesterday for excess bleeding after delivery. Her relative has now come to the police station to file a complaint that due to wrong injection, she started bleeding after delivery and is very serious. Can you update me on the present condition of this patient?
I'm right outside Tina's room. She is fine. See, sir, at the time of delivery, the uterus is the size of a jackfruit to carry a 3 kg baby. As soon as the baby comes out, it is supposed to contract to the size of your fist. By standard protocol, medicines are given to support this natural process. But in 1% mothers, the uterus does not contract, leading to heavy blood loss. And this is called postpartum hemorrhage or PPH. Tina had almost lost 2 liters of blood. That is why she was referred here, because there was no blood bank facility there. On arrival here, she was given 4 bottles of blood and now she is stable. I don't know this particular doctor, but she has done whatever is necessary to prevent the blood loss before referring the patient, sir. Thank you.
Just like how this umbrella wouldn't close on its own and sister needed help, sometimes even our uterus doesn't shrink on its own.
Yes, Dr. Tisa. Just like that. Hey, you were on night duty, right? It's 11 a.m. Go have breakfast.
Yes, ma'am. What a busy night it was, ma'am.
Hello, ma'am.
Hi.
Do you remember me?
Of course, I remember you so very well. It was your first pregnancy. You had no complications throughout the pregnancy period and had a normal delivery too. But then you started bleeding profusely with breathing difficulty. She had an amniotic fluid embolism and her blood was not clotting at all. A very serious condition called DIC. It took 30 units of blood and blood products to bring her back to life.
Working in the labor room is like an Indian soldier on the border. Without any warning, any time a firing can start.
Yes, doctor. Both are very high-risk jobs where you must always be on the alert. Our soldiers are guarding our country and we are safeguarding the mothers.
Yes, ma'am. Very true. Hi, ma'am. Your presentation last week on heart failure in pregnancy, it was a complete eye-opener.
Oh, I can never forget that incident, A normal pregnancy up to 9 months, no complications. On due date, we planned for a cesarean because of the abnormal position of the baby. On the operation table, the patient suddenly developed heart failure. Heart's pumping dropped to 30%. Patient was put on ventilator. The relatives were very angry and upset. Fortunately, the patient recovered, but the incident shook me badly. So, even in a normal pregnancy, a patient's condition can become serious suddenly for reasons beyond our control. No wonder new generation gynecologists prefer to take up laparoscopy, treat gynae cancer, instead of taking care of pregnant ladies.
Wow, ma'am. 9 months of complete normal, and then suddenly something so serious pops up. I can't imagine, ma'am.
Don't worry, Dr. Teresa, it comes with the job.
Hi, sir. I don't know if you remember me, but I was your intern sometime back.
Oh, yes, I remember quite well. I think it was that point of time when we had a patient with pulmonary embolism, and the patient's oxygen saturation was falling, and she was having so much of breathlessness, and you guys caught it. Thankfully, we had a cardiologist in the house, and we were able to save that patient. But that day, I decided that I'm not going to do any more obstetric or deliveries. I've completely left it, and I'm only doing infertility practice.
But, sir.
No, it's okay. Don't worry. I think, have you seen that video by Dr. Piley? He's an authority in our field of deliveries, and he's given a very nice video on how to handle these complicated cases. You should definitely go and watch it.
Okay.
All the very best.
Will do.
Kerala is proud of its very low MMR. MMR stands for maternal mortality ratio. That is, how many mothers die out of 1 lakh deliveries. Ours is between 20 and 30, whereas for India, it was above 100 in the last survey. We could achieve this due to the hard work put in by the health staff as well as support from the central and state governments. Whenever complications happen, the common question that we hear is, why was cesarean not done earlier? This is out of a misunderstanding. Cesarean is not an answer to all the problems. It brings with it new problems related to the anesthesia, related to the surgery, and for the future as well. So my plea is this: the public, politicians, social activists, all should understand the limitations of the specialty and support the effort of the medical team and prevent such adverse reactions if at all some inevitable complication happens. I think that will help us to work further in reducing the preventable maternal deaths in our state. Thank you.
Death following pregnancy can sometimes be compared to a plane accident. We know that most flights take off and land safely, but rarely and tragically, for reasons beyond the pilot's control, the plane could have an accident. Rare and serious complications of pregnancy work like this. Our doctors have reduced the maternal mortality rate through their concerted efforts. Let us join them and support them, and not engage in activities that destroy their morale.
The endless uncertainties and the many sleepless nights.
But the amazing moment of giving a newborn baby to the mother is enough reward.
But of course, it cannot diminish the happiness of receiving a new life.